this person. Next slide, please. Now let's look at the different forms of the narrowing of the blood vessel. When the lecturer yesterday was talking about the biochemical interactions and all that about thrombosis, I enjoyed her lecture so much, and it like, wow, it was explaining this thing. She was actually explaining this pictogram. Why am I saying it? Because thrombosis, as we see it, if you look at this chart, you'll see that there are different forms of compression of the blood vessels that can bring out, a thrombotic situation, or let me say it now, a disease or injury. So we find out that you see the different forms. Now the second one there is embolism. You see the clot has actually blocked, sealed up the blood vessels and cannot even flow at all. In that case, you find out that people with these conditions, because if that blood clot breaks off and gets to the lungs, is what you refer to as pulmonary embolism. And recently we had somebody that had, if not God, it would have been a case like this, So after surgery, a clot developed, and then the leg started swelling, and thank God it was identified on time, and it was also managed. So you see that spasm, see how the blood vessel is, the different ways that the blood vessels can compress and create problems in the body. Look at the compression, look at the case of vasculitis still, and when you have a hyper viscosity of the blood. So you see that the blood vessels, when the blood vessels narrow, whether it is the artery, the veins, or whatever, it will produce a disease condition or a problem. Next slide. Now, venous thromboembolism. We have gone through this by other lecturers. So can we look at the next slide, please? Next slide, please. So once again, we look at the risk factors to thrombosis. Others have gone through this too, and I won't want to go into that again. Next slide, please. Now, let us look at a little bit of the signs and symptoms, and that is experienced by swelling, pain, or tenderness caused by the injury. You have a skin that is warm to touch, and redness or discoloration of the skin. Then the pulmonary embolism, you have its own signs and symptoms there. Next slide, please. The preventive measures now. Blood clots are preventable and can be safely treated. I hope you saw the word I used there, safe, safely treated. So the best ways to protect yourself from life-threatening blood clots includes: one, know your risk for blood clots. Are you at risk? Recognize the signs and symptoms and tell your doctors if you have risk factors to blood clots. And before any surgery, talk with your doctor about blood clots. See your doctor as soon as possible if you have any symptoms of a blood clot. And blood clot, because blood clot can safely be treated. One other thing you need to do is to get up and move.